So there are over 600 skeletal muscles in the body, and there's approximately 125 pairs of principal muscles or main muscles that we use on a regular basis. Muscles pull on bones, they never push. And like we said, with there being about 125 pairs of muscles, muscles often work together or in opposition with each other. And that's because whatever one muscle does, another muscle has to undo. Uh, and that's mainly because muscles can only pull. So if we have muscles that pull a bone in one direction, there needs to be another opposing muscle to pull that bone in the opposite direction. When we're talking about muscle pairs, those are considered antagonistic muscle pairs. And in an antagonistic muscle pair, when one muscle contracts, the other muscle relaxes. And these are often on opposite sides of a joint to reverse a particular movement. Agonists, also called prime movers, provide the major force for a specific movement, and antagonists oppose or reverse a movement. The thing about antagonistic muscle pairs is that whatever the agonist and antagonist are, the roles can reverse as the movement changes direction. So if we think about bending our elbow, when we bend our elbow, the agonist is the bicep, and the antagonist would be the tricep. And that's because the bicep is providing the major force for bending at the elbow, and the tricep would be able to oppose or reverse that. However, if we are talking about extending at the elbow, then our agonist would be the tricep because the tricep is providing the force for extension. And in that case, the antagonist would be the bicep. So, to be able to identify the agonist and the antagonist, it's important to know exactly what movement that we're focused on. Here are some examples of specific movements and what the agonist and antagonist would be for each of those movements. In addition to the antagonistic muscle pairs, there are also secondary muscles that also work with those pairs. Secondary muscles are muscles that allow the antagonistic pairs to work more efficiently. Often there are synergists, which are considered assistant muscles. They help the agonist and they add additional force to the movement. Other secondary muscles are fixators or stabilizers. They help to immobilize the muscle's origin so there isn't any unnecessary movement that could compromise the main movement that's desired. Here is just an overview of the four major groups of muscles. Muscles move and contract in particular ways due to their fascicle arrangements. Groups of muscle cells that are wrapped in paramecium are fascicles. And the way that these fascicles are arranged will correlate to how much force is produced and the amount or range of motion that that muscle has. Overall, there are 5 general arrangements of fascicles. The parallel arrangement is when the fascicles are arranged in the same direction as the long axis. And a majority of our skeletal muscles have this parallel fascicle arrangement. Fusiform is when there is a large central region, also called the belly of the muscle, tapers to tendons on either end. And so fusiform are spindle-shaped muscles. Pennant muscles have oblique attachments to a central tendon. Pennant muscles can only pull at an angle. And depending on how many of these oblique arrangements there are will give us different kinds of pennant muscles. There can be a unipennant, where there's only one diagonal arrangement of fascicles, bipennant, which kind of looks like a feather, where you have two opposing angles of fascicles, and then multipennant, where you have multiple obliquely attached fascicles. Convergent is when we have a broad origin that converges to a single tendon. These muscles appear triangular or fan-shaped. And then circular are also called sphincters. They are formed by concentric rings. When a circular or a sphincter muscle relaxes, it increases the size of the opening. And when a circular or sphincter contracts, it shrinks and closes the opening. So different muscles in different locations of the body have different fascicle arrangements, which allows different amounts of movement, different force with different muscles, and allows overall a variety of movements that we're then able to perform. Muscle injuries. There's a few different kinds of muscle injuries, and muscle injuries in general have a long period of healing. A contusion is from direct or repeated blows. This could be from falling or jamming against a hard surface. This crushes the muscle fibers and connective tissue wrappings around those fibers. And this can result in pain and swelling. It can limit the range of motion, bruising, and a hematoma or bleeding within the muscle. A strain is an excessive stretch or tear in a muscle or tendon. And there are different degrees of severity when it comes to strains. First degree strain, there's little tearing in the muscle. You still will have the full range of motion, but there's going to be some pain due to the tearing of some of the muscle. Second degree will be more pronounced tearing, so the tearing will be a little more severe. This will start to limit the motion that the muscle is able to perform. Pain, swelling. There can even be some depression at the injured site because of the more extensive tearing. And third degree is considered to be a rupture, where you have a complete tear in a muscle or a complete tear through the tendon, and that's going to cause severe pain. And obviously then reduce the range of motion of that muscle or completely impair that muscle from performing at all. So major skeletal muscles, there are muscles that you will need to know for our next test. And the remainder of this slideshow shows different muscles, and it also gives you an explanation of what each muscle does in effort to help you remember the location of each of the muscles. When it comes to our test, you're not going to need to say what the muscle is able to do, but oftentimes when you're trying to remember the location of a muscle, it might be helpful to also know the function, because that might help you in terms of remembering or memorizing various muscles.